Thank you for watching CBS News Colorado. I'm Michelle Griego. Monkeypox is now considered a public health emergency. Cases continue to rise in Colorado and across the country. And here to talk more about it is medical editor Dr. Dave Hnida. So, Dr. Dave, what do Coloradans need to know about monkeypox, and should we be concerned?
Well, you hear the word or term global health emergency, and it's scary sounding. But really what that is from the World Health Organization is more of a heads up. It's an alert. It is intended as a preventative measure, not a panic type of measure. Monkeypox is not a pandemic. It is not spreading like wildfire. It is just really something that now we need to be on the heads up for in terms of prevention as well as treatment. If you look at what's going on in the world today, we think that there are probably about 17,000 cases of monkeypox. Go to the United States, we're looking at about 3,000. And when you come to Colorado, just a little bit less than 40 at this point in time. The big thing about it is at this point, it is limited to a very specific population group. About 98 to 99% of people who have been infected with monkeypox are gay or bisexual men, particularly those who have multiple sex partners. The other 2% we think are household contacts, family members, and so forth. It is a virus that is spread by basically surface to surface contact, close intimate contact, and it is something that is not considered to be a sexually transmitted disease. So really at this point in time, what we're saying to folks is that the risk to most Coloradans is low, but yet if you are in a high-risk group, you develop a rash, you should be seen by your doctor. If you are someone who gets a rash and becomes ill, you should be seen by your doctor as well. The state health department is giving us good guidance on how to test for monkeypox, as well as getting folks taken care of in terms of prioritizing vaccines in order to help prevent and treat the illness.
When it comes to monkeypox, what about people who go to the gym? I mean, there's a lot of sweat, a lot of germs that can be spread there. Should we be concerned about it there?
That's not considered a very high risk possibility. And I think at this point in time, once again, we're more concerned about specific high risk groups as well as household contacts.
All right, well, let's talk about COVID-19 now. The latest strain of COVID is spreading fast, with people getting the infection for the second or even third time. Does previous immunity even matter anymore?
A lot of it really depends on how you got that immunity. Was it from natural infection or from immunizations? If you take a look at natural infection, in other words, you have immunity from a original COVID infection a while ago, from the Delta variant, even Omicron in the winter or early spring, we consider your immunity, your natural immunity at this point, to be pretty much next to nil. You really are not protected very well. We are then looking at people who have had their immunization series, particularly those who have gotten their booster. We know that those folks are a little bit better protected against the variants that are going around right now. Now, a lot of folks say, hey, look at the people who have had their immunizations and yet they're still getting sick. They're on their second or third infections. The biggest point with that, though, is that these infections tend to be much, much less serious. So we know that there is a level of protection from getting immunized and boosted. And so that really is the direction that we're going. We really are not counting on natural immunity. We are really concerned that this is a type of illness that may be something that you could get once, twice, 3 times a year, maybe even 4 times a year. And we're not quite sure how we're going to deal with that. Is there going to be a one-time vaccine, like a flu vaccine, that will help you through a season, or is this something that will require multiple vaccines? We just don't know at this point in time. But to answer the question, yes, you can become infected. You can become infected multiple times, and those infections can come very close together.
Well, since you brought up vaccines, we know there are a lot of questions about the effectiveness of a second COVID booster. If you're over 50, should you get a booster now or just wait until another vaccine is developed?
I think the answer to that is get it now, and get it now. We do know that, once again, vaccines do work in terms of giving you a level of protection against the new variants, and that it will decrease your risk of serious illness. The other thing is that when you take a look at the new variant-specific boosters that are supposed to be coming out, we don't know exactly when they are coming out. Are they coming out in November, which is the current projection? Although some people are saying, well, maybe it'll be October, maybe it'll be September. Right now, we're getting inundated with cases. We're in a wave right now, so you cannot afford to wait. The other thing is, let's say we do have people wait until they wind up getting that specific vaccine in the fall. Who knows what the variant is going to be? Right now, we're going with BA4, BA5 as the variant. You know, it could be BA97 by the time these new vaccines come out. So the advice at this point in time, we know your best protection is to get your booster if you have not had one in 2022. I think the biggest point you can make when it comes to COVID, it's really been this unusual disease. It's been a weird disease. We're learning as we go. The COVID crystal ball is broken at this point in time, and we really are trying to do the best we can to keep up with things.
All right, Dr. Dave, always great talking to you. Thank you so much for all of that helpful information. And of course, you can catch all of our segments with Dr. Dave at cbscolorado.com.